Hey, good morning. This is Dr. Winters, and I want to talk with you about carrying weight that doesn't belong to us. So many times in life, we're carrying weight that doesn't belong to us. Most of us have enough responsibility in our life anyway, but if we're carrying responsibilities, weights that don't belong to us, then we're just dragging ourselves down continually. And that is not only on a physical level, but it's on all levels. And that dragging ourselves down, carrying that weight that doesn't belong to us, is driving off our hormones, because those emotional processing centers feed into the hypothalamus area of the brain, which drives our hormonal system off, our cortisol, our DHEA, our sex hormones. It drives off our immune system and makes our immune system weak or makes it vulnerable to spin into autoimmunity. It drives off our autonomic nervous system, our rest, digest, and repair part of our nervous system, and we become much too fight or flight. All those things are driven off by carrying weight that doesn't belong to us. So we need to look at our lives and figure out what weights, what responsibilities belong to us and what responsibilities don't. I'll give you a couple examples of things we see as we're working with patients. We often see people my age or just slightly younger that have children that are adults now, and sometimes we see that our role is to take care of those adult kids and to fix all their problems, when we've done our best up to a certain point, and then it gets turned over to them, and sometimes they have to fail on their own so that they can learn from that, but yet we want to fix everything, and so we're carrying that weight of fixing everything. Now, if that's true for you, then there's a couple ways that you might get at that. Counseling is one way to get at it on the conscious level, but on the subconscious level that's driving off our hormones, our immune system, and our autonomic nervous system, then we have to get at it differently. And we use a process called QNRT, Quantum Neural Reset Therapy, which reads the mind-body connection. We relay that information back to the patient, and we specifically identify brain lobes involved in that and reset the brain to that stress so that we're no longer carrying that weight and we can eliminate it. Many chiropractors that I work with, for example, can be carrying different weights of things that don't really belong to them, and we see a lot of other doctors for care as patients themselves. Many times they're carrying the responsibility of the patient getting well or not, when it's not really their responsibility. Their responsibility is to deliver an expert service. Their responsibility is to deliver information. Their responsibility is to deliver motivation and enthusiasm, but they're not responsible for the patient's choices in diet, the patient's choices in exercise, the patient's unwillingness to give up responsibilities that don't belong to them. So when chiropractors can give up the responsibility of the patient getting well, they're much more free to do what they need to do and to go forward with their office and to be the biggest help to the most number of people. So if you're carrying responsibilities that don't belong to you, get some help. On the conscious level, it could be something like counseling. On the subconscious level, that's going to drive off our immune system, our hormones, and our autonomic nervous system, look to QNRT, Quantum Neural Reset Therapy. And we'll put a link to our page where we have a number of testimonial videos about that. So look at the responsibilities you're carrying. If they're not yours, take care of that. I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined.